Hello and welcome to a special bonus episode of EpiDecoded. I'm Dr. Arora, and today we're answering a classic public health question, one that shows up in textbooks, exams, and real-world conversations alike. What's the difference between primary, secondary, and tertiary prevention? If you've ever wondered how we categorize disease prevention efforts, whether it's vaccines, screenings, or rehab, this episode is for you. Because while these terms may sound academic, they shape how we protect health at every stage of life. Let's start with the big picture. Prevention in public health isn't one size fits all. It happens along a spectrum, from stopping disease before it starts, to catching it early, to managing its impact once it's already there. That spectrum is broken down into three key levels: primary, secondary, and tertiary prevention. First up, primary prevention. This is the purest form of prevention, our attempt to stop disease before it ever occurs. Primary prevention focuses on eliminating risk factors and strengthening protective ones. It's proactive, it's population-based, and it's often the most cost-effective. A few classic examples: vaccination, like the polio vaccine or the flu shot; health education, promoting exercise, healthy diets, safe sex; environmental changes, clean water, air quality regulations, banning trans fat seatbelts and helmets. To reduce injury in the first place, the idea is simple. If we can prevent the root cause, we never have to deal with the disease at all. Now let's talk about secondary prevention. Secondary prevention is all about early detection and early treatment. The disease is already present, but the person may not know it yet. Symptoms may be absent or minimal. Here, the goal is to catch the disease in its earliest, most treatable stage and prevent progression or complications. Think of mammograms for early breast cancer detection, pap smears for cervical changes, blood pressure screening to detect hypertension before a stroke occurs, HIV testing, even when the person feels fine. This is where screening plays a major role. But there's a caveat. Not all screening is beneficial. It only works when we understand the natural history of the disease, the test is valid, and early intervention makes a meaningful difference. Otherwise, we risk overdiagnosis, false positives, and unnecessary treatment, which brings its own burden. And finally, we have tertiary prevention. This happens after a disease has been diagnosed and possibly caused damage, but we're not done yet. The goal here is to reduce the impact, slow the progression, and improve quality of life. Tertiary prevention is about management, rehabilitation, and support. For example, physical therapy after a stroke, diabetes management to prevent kidney failure or blindness, cardiac rehab after a heart attack, mental health support for people with chronic psychiatric conditions. It also includes strategies to prevent complications, like foot care for diabetics to avoid amputation, or routine eye exams to detect diabetic retinopathy early. In short, tertiary prevention acknowledges that even if we couldn't prevent the disease itself, we can still prevent the suffering it causes. To bring this all together, let's use a simple story. Imagine someone walking toward a cliff. Primary prevention is building a fence at the top of the cliff so no one falls off. Secondary prevention is spotting someone close to the edge and pulling them back before they fall. Tertiary prevention is helping someone who's already fallen by treating their injuries, giving them therapy, and helping them walk again. Each level is important. Each plays a unique role in the public health system. And ideally, they work together, creating a safety net that catches people at every stage. So the next time you hear about a public health campaign, whether it's promoting hand washing, launching a new cancer screening program, or expanding rehab centers, take a moment to ask, which level of prevention is this? That simple question opens the door to better understanding how we protect health, not just in theory, but in practice. That's it for today's bonus episode of EpiDecoded. I'm Dr. Arora, and I hope this quick overview gave you a sharper lens to view prevention, not just as a concept, but as a set of real-world strategies we use every day. As always, feel free to share, subscribe, or leave a review if this episode helped bring clarity to your understanding of public health. Until next time, stay proactive, stay informed, and stay well.